Hello everyone, my name is Tara Toll, and today I will be discussing the effects of cinnamon on blood glucose in type 2 diabetes. The ability of cinnamon to provide blood glucose control is something that I've seen in news media, social media, and other health and wellness spaces. That is why I wanted to investigate the effects of cinnamon on blood glucose levels and its potential as an adjunct diabetes therapy. Before I dive into what the research says about this topic, I'll briefly go over some facts about type 2 diabetes and cinnamon. 34 million Americans have diabetes, and 90 to 95% of those with diabetes have type 2 diabetes. As we all know, insulin acts as a sort of key to the door of the body's cells and allows cells to uptake glucose. With type 2 diabetes, insulin receptors on the body's cells no longer effectively utilize insulin, which is known as insulin resistance. This results in abnormally high levels of blood glucose. Because high blood glucose levels are damaging to the body's cells, uncontrolled diabetes may result in complications such as hypertension, heart disease, vision loss, and kidney disease. The treatment of type 2 diabetes involves healthy lifestyle changes such as adopting a healthy diet and regular exercise, as well as the monitoring of blood glucose levels. Treatment also typically involves diabetes medications and sometimes requires insulin therapy for effective management. Cinnamon is derived from the bark of the Cinnamomum genus of aromatic trees. There are actually 250 species within the Cinnamomum genus, but only 4 are used to make the culinary spice we know and love. Ceylon and Cassia cinnamon are the 2 varieties sold as the powdered spice, with Cassia being the most prevalent type sold in the U.S. Cinnamon has been used traditionally in both Eastern and Western cultures to treat a variety of conditions, and the German Commission E currently recognizes the use of cinnamon to treat loss of appetite, dyspeptic complaints, bloating, and flatulence. In regard to cinnamon and blood glucose control, several in vitro and in vivo studies have suggested that cinnamon may produce increased activation and autophosphorylation of insulin receptors, increased GLUT4 activity and synthesis, inhibition of pancreatic and intestinal amylase and glucosidase, and increased glycogen synthesis in the liver. For diabetic and pre-diabetic patients, this would potentially translate to improving insulin sensitivity, glycemic control, and lipid levels. The first study I'll discuss is a review published in the Journal of the Academy of Nutrition and Dietetics. This review sought to assess whether cinnamon dietary supplements produce clinically significant effects on glycemic control in patients with type 2 diabetes as measured by changes in fasting plasma glucose or hemoglobin A1C levels. In 10 out of the 11 studies, the participants continued to take their diabetes medications concurrently with the cinnamon intervention. Cinnamon doses range from 120 to 6,000 milligrams per day, and just for reference, 6 grams of cinnamon is slightly less than 1 tablespoon. All 11 studies reported reductions in fasting plasma glucose in intervention groups, with only modest decreases in hemoglobin A1C levels. And only 4 studies reported achieving the American Diabetes Association treatment goals of a fasting plasma glucose level below 130 milligrams per deciliter and hemoglobin A1C levels below 7.0. The authors of the study noted several limitations of the studies included. Only 4 studies contained dietary intake records. There is a lack of consistency between the cinnamon product, form, and dosage used, which made it difficult to compare the results between studies. Additionally, less than half of the studies tracked adherence, and the authors of the review also reported missing patient description data, such as weight status, diet, and physical activity changes. Overall, the authors of the review stated that current evidence does not suggest that cinnamon supplementation results in clinically significant reductions in fasting plasma glucose or hemoglobin A1C levels in patients with type 2 diabetes. The second study I would like to highlight is a randomized control trial that was published in July of this year. The study assessed the effects of cinnamon on measures of glucose homeostasis in prediabetes. The study included 54 participants with prediabetes that received either 500 milligrams of cinnamon or a placebo 3 times daily for 12 weeks. The authors of the study reported that fasting blood glucose levels continued to rise in the placebo group, while those levels were consistent in the intervention group. One of the cited limitations of this study was the short duration, but I also noted that this study did not report the participants' dietary intake or physical activity. Overall, larger studies are needed to determine if cinnamon is at all a preventative measure for type 2 diabetes, and also to ascertain cinnamon's effects on the progression rate from prediabetes to type 2 diabetes. As you can see, the research around this topic is somewhat conflicting, but overall we can deduce that cinnamon may reduce fasting blood glucose levels, but current evidence has not shown significant reductions in hemoglobin A1C in patients with type 2 diabetes. I'd also like to note that due to the lack of reliable evidence, the National Center for Complementary and Integrative Health currently does not recognize any herbal supplement that helps to control diabetes. As we all know, many dietary supplements are not benign and have the potential to produce detrimental side effects. Cinnamon is generally safe for most people, but high or prolonged intake of cassia cinnamon may be harmful for patients with liver disease due to the presence of coumarin, which is a chemical found specifically in cassia cinnamon. In conclusion, registered dietitian nutritionists should remain up to date with current research and best practices regarding CAM methods and encourage patients with type 2 diabetes to adhere to healthy lifestyle changes and recommend hypoglycemic drugs. And here are my references. Thanks for listening.